Hi, this is Dr. Eric Doner at the New York Skin and Vein Center. Today I'm going to demonstrate filling the tear trough or the dark eye hollow. And you can see on this young lady, she has some loss of volume under her eyes. Okay, some people call it a bag, some people call it a tear trough. And here. Now, in the past, when we would do this, we would use a needle technique with Restylane. Restylane is the only hyaluronic acid filler we use because it holds its shape and it's very nice for this area. So in the past, when we used the needle, we'd have to go poke, 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 poke. And the problem was not, am I going to bruise, doctor? It's how bad are you going to bruise? And I've seen as little as a little ditzel and as big as a getting hit in the face with a fist, okay? Now we use cannulas, which are tiny little tubes with a little hole on the side. And we make a little poke out here, and it reduces the risk of a bruise from 100% down to about 10 or 20%, okay? So I'm going to start doing this now and work and talk at the same time. So here we go. I've already cleaned her off with alcohol. So I'm going to make a little poke here, boop, and put a drop of Novocaine. Boop. And we're going to turn like this. And we put a drop of Novocaine. Boop. Just like that. And it turns white because of the adrenaline in it, which shrinks the blood vessels and further reduces the problem with bruising. So I'm going to make what's called a little pilot hole. Just a little there. And hold it. And I'm going to take my filler. And you see instantaneous improvement. It's very nice. Okay, right here, just a tiny drop of blood, no big deal. Problem is sometimes is getting into that tiny little hole with a tiny little cannula. So now we're going to start. We're in, and I'm going underneath the skin. You can see it if I lift it. And look up. Thank you. And I'm protecting the eye, and I'm putting in some filler here like this. And then I'm going to go over here and here. All right. Then I'm going to go deeper. And I'm just raising or laying down little droplets of the filler as I go in different areas and different planes or levels of it. All right, look forward, look up, look down. All right, you can see a very nice improvement already. And no bruising and only one little poke hole. Look up again. I'm going to put in some more. Fill in this area. There we go. All right. So I'm going to stop here for a second, just so we can look at it. And you can see the improvement already. She may get a little bruise here, unfortunately, but that's unfortunately what we can do. So you can see the difference here, that deep hollow here and how much smoother it is here. And you can't get perfection out of this, but you can usually get a good 1.5 years or more because the filler is not being moved around by the body. So we're going to move on to the other side here. So this is Dr. Eric Doner, New York Skin and Vein Center. Hope to see you soon.